Good afternoon, everyone. Welcome to Lunch and Learn with the Health Education Committee, Connecting for Youth and Mental Health. Please put your first and last name in the chat box. This is especially important for individuals who are seeking HEC credits. So, good afternoon again. My name is Chantel Archer, and I am the chair of the Health Education Committee, which is a committee for the Connecticut Public Health Association. On behalf of the committee, we would like to thank everyone for participating in this Lunch and Learn. These Lunch and Learns are meant to inform, educate, and empower people about health issues, as well as increase the competency, skills, and performance of the public health workforce as they relate to the 10 essential public health services. Before we continue, I would like to remind everyone to please keep yourselves muted during the presentation. We would also appreciate if you would enter your first and last names in the chat, which is especially important for individuals who are seeking HEC credits. And during the Q&A segment, please put any questions or comments in the chat box. Finally, this Lunch and Learn is being recorded, and the recording will be available on our webpage. Now I'm going to introduce today's speaker. Dr. Rebecca Etkin is a licensed clinical psychologist at the Yale University Child Study Center. She specializes in treating and researching pediatric anxiety disorders and related difficulties within the anxiety and mood disorders program. Dr. Etkin.
Thanks so much for that introduction and for having me at this series. I'm excited to be speaking to you all today. And so as my introduction made clear, I do specialize in anxiety disorders. And so this talk or conversation rather on mental health and youth today will focus on anxiety. But of course, during the Q&A section, feel free to ask me questions more broadly, and I will do my best to address them. Okay, so to start off our talk, I always like to begin with a definition of anxiety. This might, be obvious to some of us, but I think it's good to get on the same page about what anxiety is. I really like this definition, which characterizes anxiety as an unpleasant emotional state or condition characterized by feelings of tension, apprehension, and worry. So I in part really like this definition because I think it nicely captures sort of the three main components of anxiety. So there is a cognitive component, right? That's that worry. When we're anxious, we have thoughts about what could happen, and often those thoughts are about things going wrong, right? Bad things happening. Feelings of tension sort of relates to the bodily reactions that we have to anxiety. Anxiety really shows up physiologically. Children and adults alike often present with physical symptoms ranging from headaches to abdominal distress to muscle tension. And this can be very upsetting and this can be very uncomfortable. The piece not as much captured in this definition, but it's really, really important to thinking about anxiety is that it impacts our behaviors. When we are anxious about something, we are often very motivated to avoid it. This sort of gets into what is the key function of anxiety. Why do we all have anxiety? In part, it's adaptive. It facilitates avoidance of potential threats, right? And so with kids, we often use this example of thinking about a caveman back in the day and how would it turn out if a wild tiger or whatever animals existed back then jumped out and we didn't feel anxious? That wouldn't turn out so well because anxiety can spring us into that fight or flight mode that we probably all have heard about before, right? Anxiety sort of lights that fire for us to spring into action and keep ourselves safe. In more modern times, we can think about examples of how anxiety can sometimes help us to be successful to some degree, right? So if I am a little bit worried about giving this presentation, for example, I'm going to be motivated to prepare more so I don't have that anxious feeling as much when I present. And so that can be a good thing to some degree, right? And so along those lines, in many ways, there are developmentally appropriate manifestations of anxiety that are not always super harmful. They can be a little bit helpful. So for example, when children are, toddlers in that developmental period, having some anxiety or fear about separating from parents is not a bad thing, right? It's helpful and safe for kids to want to stick near their parents, and not to sort of go off with a stranger, right? During adolescence, some anxiety, not too much, but some anxiety about what other people think of me can be a little bit adaptive, right? There's a lot of benefits to trying to get along with your peers and to, get along with your teachers and things like that. So not all anxiety is bad, of course, but when does anxiety become problematic? Now we're getting into the realm of, going beyond typical normal anxiety that all humans experience to some degree, and we're thinking about anxiety disorders. So when anxiety can become classified as a disorder is when the level of fear really becomes greatly out of proportion to the situation. So for example, I just give the example of being a teenager that's, somewhat concerned, somewhat anxious about how they present in front of their peers. But if they are so afraid of how they present in front of their peers and what others are going to think about them, such that it contributes to intense personal distress, which could include those bodily reactions that I just described, or contributes to significant interference with their daily life. For example, maybe they're having trouble attending school because they're so afraid of what people will think of them, or they're having trouble making friends or going to extracurricular activities. This is when we can say, okay, the anxiety has really crossed a threshold to be considered something that's clinically significant, and that might be warranting of treatment. When we assess for anxiety disorders in our clinic at the Child Study Center, we really are looking for impairments in these various domains. So we're looking for impairment and interference in children's family relationships, right? How does the anxiety sort of get in the way or mess up things with their family, at school, with their friends? Again, how does it contribute to personal distress? Are we crying all the time because we feel so nervous? Assessment, and especially evidence-based assessment, is incredibly important when determining whether a child has an anxiety disorder. It's important to get at least the child and the parents' report of not only the anxiety symptoms, but all of this accompanying impairments. But also, if possible, it's great to get descriptions or reports from schools or other folks who know the child well, to sort of understand the full picture of how the anxiety is presenting in multiple aspects of the child's life. When I mean evidence-based assessment, I'm really talking about assessment tools such as self-report questionnaires and diagnostic interviews, and even observational methods that have been shown by research to be valid and reliable for assessing anxiety. So there are a number of different anxiety disorders. Again, I'm sure some of this might be review for some of you in the audience, but I want to sort of just be on the same page. The specific disorders that are classified under the anxiety umbrella include things like specific phobias, for example, of bugs, of doctors, of needles, separation anxiety disorder, This one we typically see in our younger kiddos, but it can present in teenagers and older children as well. Selective mutism is an anxiety disorder that involves sort of an inability to speak in certain social situations. That is closely related to social anxiety disorder, which was, in the example I gave of kids who are really, really concerned about what others might think of them. These are very shy, fearful kids that often try to avoid situations involving others. Generalized anxiety disorder is that anxiety about lots of different topics that sort of occurs all day, every day, right? These are our kids who are just worriers. They worry about the weather, they worry about current events, they worry about their family, their health. This is also quite prevalent amongst adults. And then we have panic disorder and agoraphobia, which are relatively less common in the pediatric population, but these are kids who have these sort of really, really intense acute bursts of anxiety. And with agoraphobia, sometimes this leads them to not want to go to public places for fear of having a panic attack. I also have OCD on the screen here because OCD in the Diagnostic and Statistical Manual that we use to diagnose anxiety disorders is now classified separately, but it is very closely related to anxiety. And a lot of youth, if they have OCD, likely often have another anxiety disorder as well. So in general, it is very likely that youth present with more than one anxiety disorder or with an anxiety disorder plus another type of difficulty. Most commonly, we see anxiety disorders co-occurring with mood disorders like depression. We see it co-occurring with ADHD, with learning disorders, with autism spectrum disorders, and with oppositional defiant disorders. These are sort of the most common combinations of presentations that we see. But the percentage of youth with more than one psychiatric diagnosis does increase with age. So it's relatively less common to see a 6-year-old child with multiple disorders, although of course it does happen, but the chances of that increases as kids get older. And in general, thinking about this whole group of anxiety disorders, they are the most common type of psychiatric disorder amongst pediatric populations. So it is more likely that a child will have an anxiety disorder than a mood disorder or a behavioral disorder. Recent estimates show that about 30% of youth will be diagnosed with an anxiety disorder at some point in their youth. This is referred to as lifetime prevalence, which is really common if you think about it. And most of these kids are first getting diagnosed before adulthood, and certainly younger than you might think. So the median age of onset is about 11 for first diagnosis of an anxiety disorder. So now let's think about COVID, because as I'm sure everyone here knows, either from a professional angle or personally or anecdotally or just from watching the news, there has been a mental health crisis since the COVID-19 pandemic. Amongst kiddos, this is no exception. So there was a recent meta-analysis of 80,000 youth around the globe, and estimates put 1 in 4 youth as struggling with elevated depression symptoms and 1 in 5 youth as struggling with elevated anxiety symptoms. And these rates are nearly doubled from what we were seeing before the pandemic. You might be wondering, well, I just said that, a third of kids get diagnosed, but that's at some point in their youth. And this is sort of at any given point 1 in 5 kids is going to be struggling with increased anxiety. So this is a really large proportion of kids. So obviously it is very salient to think about how do we help these kids. The good news is anxiety disorders are very much treatable. That's the good news. There are many humans in the world who used to have an anxiety disorder when they were a child, and they have overcome it. So I like to think of that as the glass half full interpretation of what's on this slide. In terms of treatment options, the most common way to think about providing therapy is doing something directly with the child, right? So this is either a psychopharmacology approach, right? So medication. In youth, SSRIs are mostly considered safe for most ages of youth and effective. And cognitive behavioral therapy is the treatment modality with the greatest evidence base showing its efficacy. Cognitive behavioral therapy mostly involves techniques that focus on helping kids face their fears, right? So working against that avoidance that is so typical of anxiety, and also sort of changing their anxious thoughts in ways that are a little bit more realistic and a little bit less sort of biased towards the anxious interpretation. So this type of therapy can be administered in an individual format. There are CBT groups where, kids struggling with anxiety can learn these techniques together. And sometimes parents are involved also and are helping their kids learn the strategies. And what the research shows is somewhere between 50 and 80% of youth who receive one of these evidence-based treatments, or maybe a combination of these treatments, so medication and CBT, recover following treatment. So they're no longer anxious at a clinically significant level. Now, this is perhaps the glass half empty part of the slide, because the 80% estimate is on the high end. And the reality is most studies show that it's more around the 50% of youth that recover. And so in some ways, that's great. Half of kids really benefit from these treatments. But again, glass half empty, about half of these kids don't. So how do we help those kids? Especially, again, given just the prevalence of anxiety these days. So this leads us to kind of thinking about treatment in a novel way, which is, what if we don't work directly with the child, but actually we work with parents? Okay, so why on earth would we just work with parents in treating a child's anxiety? Well, part of it is a practical matter. So there are anxious kids out there who won't engage in therapy, right? They're too anxious to talk to a therapist. They don't want to, right? It's a struggle for parents to get them into the office, right? And then, of course, there are kids who do present in treatment, or for one reason or another don't really benefit enough from it. So there has to be another way to help these kids manage their anxiety such that it doesn't sort of lead to all of that really problematic impairments that we discussed. Okay, so why parents? I think there are some obvious reasons, right? I work with kids directly, I work with parents directly. I think they can both be great approaches, but the reality is parents are with their kids day in, day out. And anxious children, like any children, are going to elicit help and support and comfort from their parents when they're in distress. This is a normal, natural process. But when we think about anxiety disorders and how they present specifically, such that kids are always perceiving that they are in some kind of trouble or always perceiving that something bad is going to happen, they are perpetually eliciting comfort and reassurance and protection from parents. And when parents respond to that, as any good parent would, we call this accommodation, right? This is this natural urge to help your child not feel so anxious when they feel anxious, right? So these pictures that I have on the screen, this family washing their hands, this is an example of a child maybe who has a lot of fears about germs, right? I'm scared I'm going to get sick. And so maybe this child is going beyond the normal CDC guidelines of washing their hands for 30 seconds, and they're washing their hands excessively to the point that they're red and raw. And then they think, wait a minute, I'm washing my hands, but what about mom and dad? They could have germs. So mom and dad, you have to wash your hands. So mom and dad, being good parents, say, okay, fine, we don't want you to be worried about us. We'll wash our hands. It helps the child feel less anxious. And now the parents are kind of participating in this anxiety-related ritual. This other picture I have on the screen of a family hiking, this might be related to a child who has a lot of questions every time the family goes out about how long are we going to be out? How do we know we're not going to get lost? How do we know what route to take? What if there are wild animals? And so parents say, fine, fine, fine. This is too anxiety provoking for you. We're just not going to go, right? This is the normal way that most parents would respond to their child in distress. What we see happen, though, is that accommodation ultimately perpetuates this cycle of avoidance, right? It's not the intention, but that can sometimes be the effect. So a child is scared. They say, mom and dad, help me feel less scared by doing X, Y, and Z. So parents say, okay, of course, we want you to feel less scared. And so ultimately the child gets to escape their anxiety. And what this does is creates a cycle whereby the next time they're anxious, they are once again turning to parents to help them avoid or escape their anxious feelings. And they're never really gaining opportunities to face their fears and learn, you know what? Anxiety is unpleasant. It sucks. I don't like it, but it's not actually going to hurt me. Or maybe this situation is actually better than I thought. It's not quite as scary as I thought. And all these bad things I thought were going to happen actually don't happen. So for every type of anxiety that I mentioned before, there is a corresponding list of accommodations that parents might be feeling compelled to engage in. So for a child who is anxious about being apart from their mother, what might their mother do? Accompany their child around the house if their child is becoming very, very distressed, if mom tries to go to a different part of the house. For a child who is nervous in those social situations and gets really distressed, in a restaurant because they have to talk to the waiter, what will the parent do? Okay, I'll order for you, And again, this is not the parent's fault, right? I'm not saying that parents are doing anything wrong here. This is the normal, well-intentioned response to having an anxious child. You want to make them feel better, and the child is basically either directly or indirectly asking for that. And so what not only our research, but research from anxiety programs globally has shown that approximately 97% of parents who have a child who struggles with anxiety report accommodating, often multiple times a day. And there are many reasons that parents say that they accommodate, because a lot of parents say, I get the sense that this really isn't helping in the long run, but if I don't accommodate, it can be really, really stressful, right? If I don't accommodate, they'll have a meltdown and I'll be late for work, or we're never going to get through our day. So a lot of parents feel like their hands are tied, that they have to accommodate to help their child. But accommodations themselves can also be stressful and time consuming for parents. For a lot of the kids that we work with separation anxiety, parents report having to lay with their child every night, sometimes for hours, and answer maybe repeated questions or provide repeated comfort to their child, right? And if they're doing that, they're maybe not as free to spend time with their other children or do household tasks. And so it sort of creates this effect where not accommodating is very stressful, but accommodating is also very stressful for families. And ultimately, the anxiety is being maintained and the interference is being maintained. So this leads us to our parent-based treatment approach, right? How do we start to get around these cycles that are ultimately keeping families and kids stuck? My colleague, Dr. Ellie Leibowitz, developed a treatment called SPACE, which stands for Supportive Parenting for Anxious Childhood Emotions. And this is a treatment for child anxiety disorders. So the child is very much the client or the patient when we do this treatment, but we are exclusively working with parents to teach them the strategies to help their child. And the two main components of SPACE are, one, figuring out ways to reduce accommodation. And we're also working on ways to increase supportive responses when a child is anxious. So what do I mean by these things? Here's what we mean by support in particular. We have determined that sort of the most effective way to respond to an anxious child is to convey at the same time some validation or acceptance of the anxiety symptoms. Validation does not equal agreement, but saying, I get it. You feel worried. This is scary for you. This is hard for you. Meeting the child where they're at. Because the minute we say well-intentioned things like, you don't need to be scared, a child might push back harder and try to convince you why they should feel scared, right? Because they don't feel validated. So even if we don't think that a child needs to feel worried, the reality is that they do. And they probably wouldn't choose to feel worried if they had that choice. And so we know that validation or acceptance of the child's experience is one important thing to convey. But it's important to convey that also in conjunction with a statement of confidence. Not that the child can do a particular thing, right? Not like, oh, I know that you can fall asleep by yourself even though you're scared, but a statement of confidence that the child can actually cope with those feelings of anxiety. Because like we talked about, anxious feelings are certainly unpleasant, right? That was in the first definition of anxiety I put on the screen. They are certainly unpleasant. We are motivated to avoid them, but the anxiety feelings in and of themselves are not harmful. They cannot do damage. And so we can say to children with 100% confidence that those feelings will pass, or the child has the power to handle those feelings or get through those feelings. And so when we combine these pieces together, we have what we call a supportive statement. In relation to COVID, we can't really promise that kids won't get sick or parents won't get sick. And a lot of kids with anxiety will try to elicit this reassurance, right? What we can do is we can respond supportively and say, I know you're worried about getting sick. I get it. And I'm certain you can handle that worry. Kids who are worried about going back to school, right? I think most kids are back in school at this point, but a child who's worried about a test coming up, right? I understand you feel scared about the test, and I am confident that you will be okay, meaning the child will literally be okay. they will survive the test. We're not saying I'm confident you'll do great on the test, or I'm confident that you can just try your best, but it's about handling and getting through the feeling. Every child has an internal regulatory system. Every human has an internal regulatory system in which our body gets back to baseline eventually. So even in the worst anxious episode, we will get back to our resting place. And so we can really say this to kids. Okay, thinking about the accommodation piece, when we work with parents in space, but this is just sort of some general advice for families, aware that accommodation has maybe become a problem and they're not really sure where to go from there. But in space, it's a very unique treatment because we really focus on helping families tackle one accommodation at a time and coming up with really, really, really specific and detailed plans for how they're going to reduce the accommodation, when they're going to do it, what they're going to do instead. And we really, really, really coach parents to focus on what they can control, their own behavior, not trying to control the child's behavior, because the child's behavior is dictated by their anxiety. And telling the child basically, stop washing your hands for too long is basically telling them not to be anxious. And then that's no longer supportive. But what we can do to be supportive is say, you know what, we understand that you're really, really anxious about germs. We know that it's okay to just wash your hands for 30 seconds. And so from now on, that's what we are going to do. And we know that you'll be okay. And we know this change might be hard at first, but you will be able to cope with it. You will be able to get through it. We always want to inform children about these changes that parents are making. So when they pull back accommodations, we want the child to know how that's going to look and why parents are doing that, because we don't want children to feel that this is punitive or that they've done anything wrong, because they haven't. But we want parents to be able to explain to their child that we are going to accommodate less because we realize this is the way to help you overcome your fears. We always use supportive statements every step of the way. We praise the child every step of the way, even if they have a meltdown when parents reduce accommodation. As long as they coped, meaning they survived the change, we can truly and genuinely say, I saw how hard that was for you, but you got through it. That is amazing. We also really focus on the potential role of people outside of the nuclear family, because it really does take a village to raise a child. And, having a child with a clinical disorder can be very isolating for a lot of families. Parents sometimes feel like they are to blame for their child's anxiety, which in no way, shape, or form is true. But having some additional folks there to help parents enact these plans, to provide additional confidence and support to the child can be a really, really, really powerful tool. And no parents should have to go at this alone. Okay, so overall, the idea is that parents can help their child overcome their anxiety disorder by only focusing on their own behavior, what they can control. It's really, really remarkable, the amazing progress that I have seen children make, and I have never even met them. I've just worked with their parents. This approach really, in a nutshell, is a shift from parents believing that they need to keep their child from feeling anxious to helping their child understand that they can be okay even despite anxiety. It's a really, really meaningful shift when children come to believe that, oh, I don't have to live my life just to avoid my anxiety. That is where the impairment really decreases. So when parents are thinking about, what they're going to do and what they're not going to do when their child becomes anxious about COVID. It's just important to have a really, really specific plan. Consistency, I think, is more important than the details of the plan itself. So if a child is asking 20 questions a day about COVID and if they're going to be okay, or about school or whatever, parents might decide, you know what, from now on, we're only going to answer 5 of those questions. And the number 5 isn't magical. It's just about parents being able to stick to a plan consistently. And really parents just, stepping into this mindset of, I'm going to make decisions based on what I believe is the right decision to help you and based on government and CDC guidelines. And I'm not going to make decisions of what I do or what I don't do based on what your anxiety is telling me to do. So to wrap up, I just want to mention a few resources, because I know resources for mental health are unfortunately very, very scarce these days. Waiting lists are long. Parents and families are struggling to connect with services. So I do want to mention that where I work, the Anxiety and Mood Disorders program within the Yale Child Study Center is actively recruiting participants for clinical trials, where if they're eligible, families can receive evidence-based treatment, including SPACE and including CBT at no cost. And there are, of course, a number of other research trials going on within the Child Study Center for OCD and behavior difficulties and other things like that. But the theme of today is anxiety. And so I wanted to mention that we are currently recruiting. And so that can be a nice avenue for families to get in the door a little bit more quickly and receive some really high quality treatment. And I know at the end, I was really focused on this approach SPACE, which is a very novel approach, but it's gaining more and more traction and popularity, I think in part because of how accessible it can be for parents. There is a website, spacetreatment.net, that just has a host of resources, including books parents can read, articles. There is a list of providers who are trained in this approach. And there's also a little YouTube channel that has some informational videos for parents as well. So with that, I think I am probably well over my time. Okay, I'm all right. But thank you all for listening, and I really look forward to addressing some questions.
Thank you, Dr. Thank you so much, Dr. Etkin, for a wonderful presentation. I'm now going to turn things over to Dina Missinello, who is one of the Health Education Committee members, and she is going to facilitate our Q&A segment. Dina?
Yeah, thank you, Chantel, and thank you to Rebecca. That was very informative. I wrote down, you don't have to do anything you don't want to do, and I kind of equate that to my parents' accommodations to what I might have had as a kid. Mm-hmm. If I was anxious or anything, nope, I don't want to do it, so I don't have to go. Mm-hmm. And sometimes they might have been able to work with me better in that. So that program sounds great that they could have helped. I do offer anybody to put their questions in the chat box. You could raise your hand and unmute if you want to. We did have one question from Augusta. I don't believe that she's still in the Zoom room, but I just wanted to bring it up. She asked that she says she sees the benefit of working with parents and caregivers, but her concern is children in the Black or Brown communities who don't necessarily have any parents or caregivers due to COVID or other loss. I'm thinking just some supports that would help that.
Yeah, absolutely. That's a really great question, and it's a truly unfortunate situation. What we are working on from a programmatic perspective is training more and more folks in the community on this approach, right? So one thing that I am particularly passionate about doing is working with schools to train teachers, counselors, social workers in this approach. So, you know, even if a child doesn't have access to a parent, they can still benefit from hearing these supportive messages, having people who are really well versed in understanding anxiety, how it works, the different ways it presents. And so I think that again, just one of the goals of our program is expanding the number of folks who can still deliver these important strategies and messages to kids beyond parents. We also do, I focused on parents, but accommodation is often a family-wide process. And if children are living with grandparents, with aunts and uncles, with foster parents, they can still be trained in this approach. Absolutely.
Right.
So that's one thing I'll say. And then for other resources, I think, obviously, like I mentioned, traditional child-based approaches do have a lot of evidence of efficacy and still can be a fruitful avenue for kids who don't have parents who are able or willing to engage in treatment.
Right. Yeah. Thank you for answering that. I know in my professional life, we do a lot of work with trusted adults, and we always try to mention that they don't need to be your parents. They're already your trusted adults. So you should have somebody else to that you can reach out to.
Totally.
We had one more question about if the PowerPoint will be available after. I just wanted to ask you if we could share your slides, or if we should
I can share them in I can share them in a PDF version. I just ask that, you use them for your own use and don't redistribute, but I can share those with you.
Of course.
So you can circulate them.
Yeah, thank you. We have some thank yous in the chat box and how wonderful your presentation was. And I agree.
Oh, I'm so glad. I'm so glad.
Yeah.
It's a pleasure to present.
Yeah. The program that you mentioned at the end that people can, your program that people can come in and get treatment at no cost, that really excites me because so many people do not have access to treatment right now. So I'll definitely keep that in mind.
It's a big problem. I would suggest that if folks in this forum are working with families who they think could benefit from some anxiety treatment, definitely encourage the families to at least reach out to our program. We'll have an initial phone screen with them, see if they might be eligible. And if they might be, we'll bring them in. We'll do a really thorough evidence-based assessment, which in and of itself can be really important for a lot of families to take that first step. And if they can receive treatment, even better. So I certainly would encourage that.
Yeah, just a follow-up question to that. Somebody asked, can adults also utilize this or just children? Yeah,
so this study and what we do in the Child Study Center is just child-focused treatments. The Yale School of Medicine, more generally speaking, probably has many clinical trials going on for adults. And so I would encourage folks to just check out the Yale School of Medicine website. And there's a section on clinical trials. And so you can search within that and see if there's anything that might be a good fit for you.
Yeah, thank you.
Yeah. And these studies that we have ongoing in our program right now are for children aged 6 through 14, I want to say.
Okay.
So that's the age range we're looking for. And we're certainly always looking for more for youth and families from diverse backgrounds and populations. So, we can encourage everyone to contact us.
Yeah, for sure. There was just another question that someone put in the chat box. I invite them to unmute if they want. If not, I could also read your question. Up to you. I will read it since if they can't unmute. They say, hello, your strategies appear to be clear-cut in approaching mental health with children. However, we know that children aren't clear-cut, especially children from distressed areas. What adjustment and resources are available for children with alternative needs, cultural, racial, etc.?
Again, it's a great question. And this, I will say, this treatment is really, really specifically designed to treat anxiety disorders. And it is true that it is very rare that we have a child who really just comes in with a little clean anxiety disorder and nothing else, right? Children and families are extremely complicated, are facing a lot of different stressors, have a lot of different needs. And so what we do is, we often say, because this is a short-term, really problem-focused treatment. So what we'll often say is, we're going to focus for these 12 weeks we're doing this treatment on the anxiety disorder. And then, let's talk about what you want to prioritize next in terms of your child's care, And if something is more pressing than the anxiety disorder, we would refer the family to seek services for that first. So for example, if a child was struggling with, trauma, or with, they were having the family was having difficulty with housing concerns or something, we would not say, okay, this is the treatment we recommend first right now. We really need to think about accommodations. No, we sort of think about the hierarchy of needs and what services are of the most pressing importance for the family. And when they have sort of the time to dedicate to the anxiety disorder, then we'll tackle that.
Right. I do see that Vine, I apologize if I'm saying your name right, unmuted. So if you want to come and chat, go ahead.
Yes, hi. I was just wondering, I've been doing a lot of research on the numbers of African American and Latino therapists that are available in communities, and it's really a poor situation.
Yes.
And I think that it's really important to increase those numbers, because I'm not saying that a white person can't understand or identify some anxieties that are going on with a black child. But that black child might be labeled a little differently.
Yeah.
If they had an African American example, or someone who is their therapist and sees the cultural understanding of what is going on with this child. So,
Absolutely.
My organization, that's one thing that we're going to approach actually next week, in talking about behavioral and mental health towards health equity.
It's extremely important. And I think that you are so right that it's a huge systemic problem that, that therapists do not often represent the communities they serve in terms of their skin color, their ethnicity, their race. And I think it's a problem that is beyond just one organization to address. It really has to be a much larger systemic change. But with relation to our treatment of anxiety, it's extremely important for us, especially as white therapists working with populations of color, to be very sensitive to what is sort of that true anxiety that is not super based in logic. I'm worried that if there's a storm, my house is going to blow over, versus what are actually real life situations that children should be anxious about. I'm working with a family right now, and the child is of mixed race, and they overheard a child made a racist comment at school, and they came home and they were extremely anxious about that. And that's not something that I would suggest the mom would just say, oh, just use a supportive statement and tell them, I know you're anxious about racism, but you're going to be okay. Absolutely not, And so I think context matters so much. And I really appreciate your comment. It's something we need to continue to work on as well.
Thank you.
Yeah.
Yeah, thank you for your question. So if anybody has any other questions, I'm sure we can stay on for a little while longer. I'll give you some time to ask those. Chantel, I don't know if you want to do the closing remarks now, and then we can stay on till our time.
Thank you, Dina. So I am going to put a link to the evaluation in the chat. So I encourage you all to complete that evaluation, especially for those of you who are seeking CHES credits. And yes, like Dina said, if anyone has any additional questions, feel free to ask. We have, a couple more minutes left. In the meantime, I would like to give a special thank you to Dr. Etkin for a really wonderful presentation. Thank you, Dina, for also facilitating a great Q&A. And last but not least, I'd like to thank all of you for attending this first Lunch and Learn of the year at the conclusion of National Public Health Week. We hope to see you at future Lunch and Learns. And I hope everyone has a great weekend. I'll leave the meeting open in case anyone has any last minute questions.
Yeah. And thank you to Chantel for organizing this meeting today.
Yeah, thank
And
you all. Thank you all. I appreciate it.
I'm going to put the link to the evaluation in the chat right now. Okay, so it's in the chat right now, everyone.
Yeah. In the beginning of your presentation, you mentioned like it's okay for kids to be upset if somebody's new around. And when I babysat for a long time, many years, parents would always apologize for kids getting upset when they left. I was like, it's okay. There's a stranger here. They're allowed to have a little anxiety about it. So it was just nice to hear you say that.
Yeah, I would encourage folks to use this advice professionally and personally if it applies, for sure.
Yep.
Thanks. All right.
Yeah, so we'll probably give maybe a couple more minutes and then thank you all for coming. Chantel, do you think we're all set?
Yes, it looks like we don't have any more questions. So thank you again, everyone, for attending this Lunch and Learn, and we hope to see you at the next one.
Yes, thank you.
Have a great weekend.
Thanks.
Bye.
Bye, everybody.